So, hi, my name is Peter Oykman, and I'm with PsyTech VR, but I'm also co-chair on this VR ARA mental health, health section. And PsyTech VR, we started about 3 years ago with one goal in mind. We want to focus on various forms of anxiety, and we created an application in virtual reality that provides a exposure therapy in you know more immersive settings, and that was our starting point. Of course, in a last couple years, um, a lot of things change with this AI, and now we're instead of doing these predefined scenarios for exposure therapy, we're more focusing on AI-driven models that provides a more flexibility and more options for um, our clients and our community, and that's why we brought essentially Dr. Panattoni and Dr. Roddick here to as a people who are having a practical experience with our application and who could actually tell you more about what's going on in the real world, and I think it's extremely important. But I'm also here with my partner Daniel, and he will tell you a little bit more about AI stuff and what's going on in that world. And basically, I just wanted to basically, tell Daniel and Dr. Panattoni and Dr. Roddick, go for it. Tell us.
Okay, I can continue. Sure. So everyone was keep talking about how AI can help therapists, and industry has seen some interesting cases of AI for taking note during the therapy or AI for patient self-reports analysis. But we decided to go in a little bit different way. We were the first company introducing AI for therapy in terms of emotional exposure, in terms of the exposure therapy. Everyone knows that about like 75% of all the therapists are using emotional exposure, but it's also widely known fact that our brain and our body sometimes are building barriers towards imagining this anxiety visuals. And we, as every other company in the industry, start creating VR exposures for 3D scenarios. And this was like a free models combination of 3D models, a lot of different scenarios. But even that day we knew that is very limited. And one thing actually happened about a year ago. So one therapist came to us to try PsyTechVR, and she requested about 2-3 weeks free trial for her client who had a phobia of dogs. Well, she tested it and she came with a feedback or a follow-up call, and she said, "Yeah, the dog." So she said, "Guys, you've got a scenario for the phobia of dogs where there's a Labrador, cute boy. You can cuddle it, you can throw a stick, great. But my client, he was experiencing a phobia of a German Shepherd." She said, it's like it doesn't really work. She was wondering, can we do something with it? Can we create another 3D model of a dog? We decided to go in a different way. We developed our AI to create exposures. That sounds crazy, but within 30 seconds, the therapist can write down a prompt. Let's say you're looking for this German Shepherd somewhere. So the AI can help you visualize this exposure in the VR just within 30 seconds. And now we learned how to make it animated. We learn how to bring sounds so it's more engaging, it's more immersive in the VR. And just a small piece of our roadmap for 2025, we're already developing the AI to create 6 degree of freedom scenarios. Whether it's an enclosed apartment somewhere in New York, or it's a subway or underground, our AI will allow you to create 3D 6 degree of freedom scenarios for exposure therapy. Okay, I don't want to take any time of our therapists. The microphone is yours.
Okay, I'll jump in. I'm Dr. Gwilym Roddick. I'm on the advisory board of PsyTechVR. I'm also the founder of a practice called CBT of Central and South Florida. I'm also the co-founder of the Florida CBT Association, and an active member of the Association of Behavioral and Cognitive Therapies. So I started using VR therapy over 10 years ago, back when we were hooking it up to machines and using just PCs, and um, it was helpful, but it started to get to the point where we were using things like pictures and YouTube videos more often in the headset. So what I love about the technology is that it's changed so much and for the better. Things are a lot more stimulating, they're a lot more real, and also they can be more specific. I use VR therapy as a form of exposure therapy for things like obsessive compulsive disorder, post-traumatic stress disorder, phobias such as heights, public speaking, needles, driving, insects, animals. And you may say to yourself, well, that's not the same thing as going full on in vivo, which is actually doing the thing. But my goal for my clients is to get them to practice things, is to get them to reduce forms of avoidance, is to get them to not control how they feel, but do the behavior anyway. So VR allows me to do that primarily with clients that are very severely distressed by these things. They have either avoided planes for decades, they overly sedate themselves when they're in certain situations, such as public settings or on planes or in cars. And this negatively affects their social, their professional, their financial, and their familial relationships. So it really can be such a negative thing in their life to avoid these things. So what I like about the platform and the program and what Daniel and Peter are doing is that it allows me to control the environment where I get to add specific triggers where the client isn't flooded, and also a lot more accessible. For example, I don't own a bird, so I can't always bring a bird into an office if somebody has a bird phobia, right? But I could use the VR to do it. I can't take someone to certain places. That's also more cost effective for therapists because not so long ago, and some therapists are still doing it, it would cost them several $1,000s to get their therapist to take them on an airplane. Whereas I can start to get them on a process of doing that in my office and then empower them to go do it on their own, which is the goal. I don't want them to stick around with me because that can be a form of reassurance seeking. Well, if Gwilym's here, then I'll feel better, and they're using me as a safety behavior. So this is priming them and then getting them to go out. Um, you know, again, I think the wonderful thing about the AI is that the more specific we can get, as Daniel was saying, someone's, for example, OCD trigger may not be a dirty kitchen, but it might be the chemicals, like a bottle of bleach that's on a counter that just contaminated their kitchen.
Dr. Roddick, so if you, I'm sorry to interrupt you, but we have a very limited time and like that. I just wanted to, Dr. Panattoni to have a chance.
Sure.
Sorry.
Hi, I'm Dr. Lynn Panattoni. I'm a functional psychotherapist at Turnpaw Health. We have 4 locations in central Pennsylvania. I primarily work with people dealing with mood disorders, anxiety disorders, trauma, sleep disorders resulting from autoimmune diseases. And I have really focused in the last 10 years on integrating mental health therapies to help my patients deal with these negative symptoms that they're having that are so intense, and PsyTechVR has really made that easy for me. I'm able to bring them in and have them relax using muscle relaxation techniques and calm them down, then do the exposure therapy, which PsyTech allows me to increase or decrease the intensity of that experience. Also, what's been very helpful is the biosensors that allows me to track their pulse, their heart rate variability, their concentration, their stress levels, point that out to them because many times there's a disconnect between what they're feeling and what's really happening inside their body. And then I'm able to use generative AI to create literally any experience that the patient wants to have and calm them down. If they feel good at the beach and there's a very specific scenario at the beach, I'm able to create that and then insert those coping mechanisms that are so important, like the breath work, the mindfulness meditation, the binaural beats, coach them through that. They're feeling safe. So when they get stressed, we're able to show them where they're holding stress in their body and help them then utilize those coping mechanisms. It has just been a real game changer for me to be able to integrate all of these therapeutic modalities and provide support for the patient at the same time. It gives them the confidence to then go out in the real world, as Dr. Buck said, and use these and access these tools. I had a patient who was flooded with smells and sounds and lights and just could not go to the grocery store, could not be in a vehicle as a result of Lyme disease. I used the exposure therapy for driving, and within 3 sessions, he reported that he could now be in a car and, enjoy himself, look around, engage with the driver, and go to the grocery store. It literally gave him his life back.
Thank you. Thank you for this wonderful, experiences and testimonies. The only thing I personally want to add that even 3 years ago, when we started developing our first version, right, and we had a completely different idea. And with AI, with the generative AI, in the last couple years, we basically changed. You know, technology changed. We changed our direction completely. That's the only thing I wanted to add. And it will be even more changes in the near future. So that's about it. I guess that's all the time we have. But thank you very much for listening. Thank you,
Thank you
Chris.
so much, Peter. Thank you for co-chairing our healthcare committee. And for anyone who wants to join that committee, we have online sessions led by Peter and Tets and others. Thank you so much again. Moving on, our next speaker is Ray.